This is an instructional video on how to ambulate a patient with tethers. We define tethers as any line connected to the patient that can hinder movement and increase the risk of falls or injuries. Some examples of tethers would be any line connected to a monitor, oxygen, an IV, or a catheter. When you're planning to ambulate a patient, one of the most important things is to clear the pathway to make sure all obstacles are removed to decrease the risk of tripping. Remember, if your patient has more than 2 tethers, you need to have more helpers. Get an assistant. It's important to have a gait belt on your patient to help and have a hold for when you're transferring them. And also make sure they're wearing non-skid slippers to prevent more falls. Confirm that the bed is locked and it's at an appropriate height for your patient. If you have a tall patient, the bed will need to be higher. And if you have a short patient, like Verona, you will need to have the bed low and locked. Also, before moving your patient, assess that they are at an appropriate level of consciousness, and also have a wheelchair or walker within range of the bed. You need to limit your tethers, so talk to a nurse and she can saline lock the IV for you. This will help limit the amount of tethers so that you won't have to wheel your IV with you. And you can also disconnect them from vital signs monitors while you are ambulating them. When you are ambulating somebody that has a Foley catheter as one of their tethers, you need to make sure that the bag remains below the level of the bladder at all times. One of the ways you can do so is by hooking it on their walker or wheelchair below the level of their bladder, like Lauren is demonstrating now. You need to make sure that there's enough slack so that you're not causing tension on the urethra, and that will also prevent injury to your patient. Once you've assessed everything, you can go ahead and ambulate your patient. And if you are communicating with another individual, you can make sure to coordinate with them and talk to them, saying things like, "Will you take the oxygen tank and follow us with the wheelchair?" You need to keep the patient's safety in mind at all times and continue to assess them to see if they are comfortable, if they are feeling faint or dizzy, and if they can continue walking. If they're feeling short of breath and are unable to continue, you will want to assist them by sitting them in a wheelchair. Remember, communication is important, and you need to just take it one step at a time. That's it.